Jadis, co-founder and CEO of Motivo Scar Care. Founded Motivo Scar Care through my personal experience transitioning from female to male and receiving a top surgery. Dr. Jonathan Keith actually performed my top surgery. The follow-up care to the top surgery was to wear scar care products and really tend to my scars, which was something that I hadn't learned or experienced with any other previous procedure. Tried multiple different brands and had a negative experience with all of them. And those experiences varied from scar tape falling off to topicals either leaving greasy residue on my skin or drying out my skin. I stopped wearing these products, which ultimately resulted in my scars becoming stretched and keloided. We tried some different interventions to try to help with the scarring and minimize the visibility of it. Ultimately, I had to get a second surgery, a scar revision procedure, and the follow-up care was to wear scar care products. I wanted to take it more seriously that time, but I also didn't want to continue to go in circles and use these products that didn't seem to really be not only not that beneficial for the scar, but for long-term skin health as well. So Dr. Keith and I decided to partner up and form Motivo Scar Care.
Thank you, Rye, and thank you, Jadis, and everyone attending today. I'm Dr. Jonathan Keith, a plastic surgeon, fully focused on gender-affirming surgery at this point in my career. As we mentioned earlier, the scar care and your scar journey is very individual for everybody, and we're not here to sell anything or do anything like that. It's really just information, education, support, a safe place to talk about scars, not just from surgery, but from all sorts of things, so that we can have a basis for understanding of how to give your body's best chance to heal and heal well, and what it means if things need to be revised or fixed. I mean, that's part of a surgeon's job too, is to help fix things and make it right. So I'm looking forward to having this discussion. Jadis has some slides to talk about, some general information, and then we're going to come back and talk some more about how scars form and what does that mean. And also kind of an ask me anything, if you have questions beyond just a scar, about gender affirming care and surgery, I'm happy to answer those as well. So thank you very much, everybody.
Thank you, John. And I'll go into these slides. So something that I've always felt is that scarring is something that creates a dysphoria around someone's image and which goes along with how they internalize their beauty, which is exactly how I felt after my top surgery. Excuse me. So as I mentioned before, Dr. Keith and I met during a surgery consultation. He performed my top surgery and my revision, and that's how I personally became educated on the importance of scar care. So understanding scarring after top surgery. Top surgery is a life-changing procedure, and the healing journey doesn't end when the stitches come out. Scarring is a natural part of the process, but not all scars are the same. As Dr. Keith mentioned before, it's really a unique experience. Understanding how and why they form is the first step to healing better and having better outcomes. So we want to understand that scars are the body's way of repairing after a skin injury, that everybody heals differently, and proactive scar care can significantly improve appearance, texture, and comfort. Some types of scars that can form after surgery can be a flatline scar, most common and typically fade over time. Hypertrophic scars, they're thick, raised, red, or pink. Keloid scarring, firm, and cause a lot of irritation and itchiness in the incision site. And stretching scars. That was the issue that I had with my scars, is that over time they became really stretched because that area of the body is subject to a lot of movement. Genetics play a huge role into how people heal, and healing is very personal. I mean, how you heal and how you scar depends on your skin tone, family history, collagen production, and hormonal changes in your age, and your overall personal health routines as well. So, as I mentioned, this is a personal photo of me after my first top surgery. After I stopped using scar care products, the little white areas are where we tried steroid injections of the scar to help to try to diminish the appearance of it. But I mean, I could have avoided this with the use of scar tape and other interventions. It was something that I personally wasn't educated enough on, so I didn't take it seriously after my first surgery, which resulted in my scar stretching and me having to undergo another procedure. And that's it for my slides.
And I just want to piggyback or dovetail off of what Jadis was talking about there. When I see a patient in consultation and we spend an hour together to talk about surgery and its effects and what things to think about before, during, and after, and how to take care of your scars, a lot of studies show that patients only really retain about 40% of that. And what you heard there, and it's a common thing with a lot of patients, is a lot of self-doubt, self-blame for how something turned out, how it looked. And it's not true. Jadis did a lot to try to take care of his scars. And sometimes it's a combination of things that make it difficult to take care of your scars. And it's not just about education, although Jadis, could have done better possibly. We try to educate. The patients try to educate themselves. There's more resources than ever online than there were, 15, 20 years ago. Sometimes the body has a hard time. It's a trauma. And the components of healing take a while to really see those effects. Whenever I see a patient in consultation, I tell them, listen, it's kind of equal parts your genetics, which is what this was alluding to with family history and skin tone. Genetics are a huge component of this. The technique involved, how does the surgeon operate? What are they doing to minimize tension across a scar? That's really important. We know that tension has a lot to do with how a scar is going to form. And so what techniques are we employing to decrease that tension? And what are we doing after surgery to take care of it? What techniques are we doing to help with aftercare? And so if you think of the scar journey as those three things, some things you can control. Who do you go to for surgery? Have you looked at what those things are for elective things, obviously, for trauma and for, other types of life events that aren't, at an elective type surgery, you don't have control of that. But things you do have control of, things like this, where you're planning for a surgery, what things you're going to do to take care of your skin and your health and your overall medical status before any surgery, and what are you going to do afterwards? And some things are going to predispose you to an increased chance or likelihood of having a poorer scar or a thicker scar. And so what things can you do to try to prevent that? Jadis mentioned that he started this company, and he did. He brought this idea to me and said, I have this idea. I want this to be a better thing for people, not just me, but I think that people should have better access to better types of solutions. And like I said, we're not here to sell anything or anything like that, but I just want to commend Jadis on his own personal journey of trying to improve access to better types of ideas for scar care, because a lot of what was out there it doesn't work that great. And yeah, and it's a really congratulate him for taking this seriously and trying to help others. And I love that I could be a part of that, because I am not a business person, and I don't know how to do any kind of business meetings. You can ask Jadis. I'm terrible in those things, but I like to know that the thing that we're working on together is going to help people, because that's why I became a doctor, was to try to help people. Scars are the body's response to a trauma, whether it's surgery or whether it is a true trauma. Your body has this natural defense system within the skin. It's the largest organ of the body, the skin. And its natural response to this trauma is to heal it, but it doesn't happen overnight. It really takes almost a full year. So when I'm counseling patients about those three components of scar care, which is in scar formation, genetics, which you can't control, technique, well, you can't control that as the patient either, but you can make informed decisions about that type of technique in terms of who you receive care from. And then aftercare. Now that's fully in your control. What are you going to do? You're going to put everything into it to heal as well as you possibly can. And so really it's about that component of this, as a patient someone undergoing these types of procedures, what can you do to increase your odds that you won't need a second surgery? Because that's, another time point where you have to put your life on hold and have somebody take time out of your life and ask for help from people around you to get through something and heal all over again. So we want to avoid those things. There are some studies that are suggesting now that exogenous hormone therapy also has an effect here. And specifically, testosterone therapy for patients having exogenous testosterone therapy really increases the chances of getting those thicker or keloid scars, which is a real bummer, frankly, that a lot of patients, following an algorithm from their prescribing doctors will go on hormone therapy before any surgery. And so what we have seen now in the scientific literature now is that those patients tend to have thicker scars because of the testosterone use, which is, again, very frustrating. So how do we try to work around this? Well, education. We know that scars form in response to the trauma. It's a natural part of the body's healing process. And we want to make sure that the microclimate, or basically the milieu, this little microcosm of environment around the scar, is optimized. So the science tells us the best way to do that is to hydrate the skin. And there are different products and things you can do to do that. Some people use vitamin A and D ointment. Some people use Aquaphor. Bacitracin's often applied to fresh incisions. That only goes so far. And some of the best data out there suggests that silicone really plays a much better role in terms of creating a protective barrier over that newly formed scar. So most surgeons would say, hey, let your skin heal a little bit, let it mend, usually for a period of time, or somewhere in the range of 4 to 6 weeks before we start applying something to this scar, this newly formed scar, to keep it hydrated, to allow it to be in this environment where it's not going to dry out. And so silicone plays a major role in that. There's lots of products out there that try to get silicone onto skin around scars. That's why you see scar tape. That's why you see scar gels and creams. And to Jadis's point, a lot of them are sticky or greasy. I can't wear a shirt. It's a weird product.
I try to avoid silicone products, topicals especially, that also contain alcohols in them.
Yeah.
Because then it kind of doesn't help the silicone do what it needs to do in terms of protective barrier moisturizing, because the alcohol will dry that out.
Right. And that's something we always tell our patients when they're trying a new soap or a new lotion. Don't use anything with any scent in it, anything that smells like rose petals or such. Those things have alcohol in it. That's how they get the scent in there, and that will dry out your skin, and that's defeating the purpose. So we know that if we can protect this newly formed layer of skin with creating this microclimate, usually with the use of silicone, that scars objectively heal better. What do I mean by that? I mean that they've put a panel of people together to rate scars, and those scars seem to be less raised, less wide, and a lighter color. But you also have to realize something about time. Most of those pictures that Jadis showed were earlier post-op results, some of them later, but a lot of them were early. And you can tell because scars go through a maturation phase, and it takes about a year. And I'm not just talking about top surgery. I do all sorts of surgery, facial surgery, top surgery, bottom surgery, in addition to all the other plastic procedures that I was trained in and did for many, many years as a board-certified plastic surgeon. Scars everywhere on the body go through the same phases of recovery and healing, and it really takes the body about a year to fully mature that scar. So, for example, when we talk about vaginoplasty, which is not something we discussed earlier and there weren't any pictures of, and that's fine. We're not here to really dive into that. But if you think about vaginoplasty with respect to the canal that we make, that's a scar. And that's why patients have to dilate for a year after surgery to keep things open, to stretch that scar so it doesn't constrict. Because linear scars heal by getting shorter, but a circular scar will heal by getting narrower. And that's the problem wherein you get strictures. It's the same thing when transmasculine bottom surgery, phalloplasty. Patients undergoing those procedures suffer the same fate of problems with, scar formation. It's just not a visible scar that you can see on the outside of the body. It's scars on the inside where we're lengthening urethras and trying to make a tube in a tube so a patient can stand to pee. Well, now they can't because there's scar formation. And so the same idea there is when we create these new urethras, we use a silicone catheter for a period of time to help prevent some of those problems of thicker scars forming. So Scar formation everywhere in the body, all sorts of areas of the body, is something that we combat as surgeons all the time, trying to make the patient experience better and prevent complications. And so it's not just about what you can see, the visual stigmata of a previous surgery, it's other things too. But it's also the mental, weight of having a scar and what it means. And stigmata is a good word too for that. I love it. I went to Pride on Sunday. I got to be out there with former patients and family members. I brought my kids. We were able to walk around and feel safe. And, you can see patients and see scars and people are proud of it. But it's also, if you weren't in that space and it didn't feel safe, then it's something that can be, targeting. And I have patients who come to me all the time say, I don't want a radial forearm phalloplasty because I think that people would know what that means.
Yeah.
Same with self-harm scars. A lot of patients come in and part of the exam is you have to take your shirt off so I can look at your chest. And they're very anxious about me seeing those because they think I'm going to judge. And so, I'm not, and none of my team would, but I get that. I get that we have these kind of visual cues on our skin that tell a story that maybe we're not ready to share. So it's challenging. It's a challenging space. And it's something, as for me, as a surgeon, I wasn't taught any of this. It's not part of the curriculum when you're training to be a doctor and training to be a surgeon. There's certain specialists that learn a little bit here and there, but this is really a lot of on-the-job training. And I've been a surgeon for a long time now, and I've had to come up with a lot of these ways to minimize or mitigate the effects of scarring. And a lot of this, in the last few years has been working with Jadis to really understand the lived experience and what people need and how can we make it better. Anyway, I've just been droning on there for a while, but I think that's the important things to take away is that there are products out there that can help. There's a lot of really expensive stuff out there that won't help that much. But basics, think about how do I take care of my skin? What is good for skin? Well, hydrating it, keeping it out of the sun. That first year after surgery, you really don't want to get a sunburn or even a suntan within that fresh scar. It will permanently tattoo it and it'll be even more visible to you. So,
Do you like a scar, I know we spoke about, it takes about a year to mature. Say someone like me, for instance, during my first top surgery, because of my negative experience with the products that I was using, and, I was like, okay, I'm just not going to wear them. So, we go beyond that year, beyond that second year. What can someone do, you think, for an older scar before getting to that point of like, we need a scar revision procedure to help?
Yeah, so I tell everybody with the fresh scar, you want to do something to take care of it for at least the first 4 months. As soon as the glue comes off or the steri strips come off, if you've had an elective procedure, as soon as the doctor says it's okay for you to start doing something, do it. And do it consistently. It's all about kind of continuous contact with the skin, as long as that thing that you're applying isn't causing a problem. So sometimes more of a good thing is a bad thing. And I've seen that with patients who, we initially will apply something like bacitracin to their skin, and they will do that religiously every day, multiple times a day. And all of a sudden they come back and they have a rash everywhere. Your body is a living, the skin is a living part of you, and it has defense mechanisms built in, and it doesn't always like being repeatedly assaulted by certain, chemicals. And so it's about how do we kind of take care of it? How do we treat it nicely so it doesn't get irritated? Certain things can cause a lot of irritation. So it's about staying out of the sun. It's about creating these microclimates around these freshly healing areas, avoiding things that can cause hives and other irritations, avoiding harsh chemicals, being nice to it. I think somebody asked about maturation. It's a great question. Really, the full process takes about a year. Within 48 hours after any kind of surgery where sutures are placed in incised skin, it's usually watertight. Most surgeons will let you take a shower within a couple of days as long as there's not implants or drains in place. So it takes 48 hours for that watertight barrier to become kind of sealed, even though you could pull that scar apart easily at 48 hours. But that's how fast the body is mending and putting a cellular bridge across that divide. It really, the more tensile strength of skin takes more time before we're going to stretch it and stress it. And so it's closer to 4 to 6 weeks before we're starting to feel confident that the types of sutures that we use, they're not doing the heavy lifting of keeping the skin together anymore, that the skin itself has repaired enough, that we can start letting you do more things in terms of increasing weight and doing more exercises. And similarly, the aesthetic of it, what it looks like, is changing over that time period too. Initially, you're just going to see skin on skin. And then by a month, you might see kind of a dark, thin line, and it'd be maybe a little bit purple. And that will get more intense and violaceous over the course of usually up to about 3 months. And then after 3 to 6 months, it goes from like kind of a pinkish to purple, and then it starts to fade. And it'll fade back to usually, the baseline skin tone that you have, sometimes a little bit darker. Darker skin people, anyone with some melanin in their skin, will often have a thicker and darker scar. It's just genetically predisposed. And so that's a challenging topic, and you have to bring that up. And for me personally, I show pictures, representation of patients with different skin tones and body types, so patients get a sense of what this stuff might look like and how it's going to heal with them over time. And it does bring up the idea of how do you know that something needs to be addressed? And really, you want to give enough time, get into that after kind of the zenith of healing, when we're on the curve back to kind of baseline, the scar is done maturing, somewhere in that 9 to 12 month mark, that, okay, maybe this scar is a tough one. We don't love how it looks. It's itchy, it's painful, it's raised, it's large, it's widened. What things can we do there? And that's where you start talking about steroid injections. There are laser treatments that can happen, and then even the role of revision surgery. Keloids themselves are a whole different topic, and I treated a lot of really tough keloids for a long time when I was practicing in Newark, New Jersey at the University Hospital. And patients actually need a coordinated multidisciplinary approach for keloids if they have a strong family history or personal history of that. And we're talking about not just for top surgery, it could be for your ear or anywhere, because that is a hyper-proliferative response to a trauma, and it goes well beyond the bounds of where the original scar was. And those patients actually need not just revision surgery, but often external beam radiation therapy to help prevent that from coming back. And that's something that would be done with radiation oncology. So that's a whole nother level. Obviously, that's not something you buy in the pharmacy, but it's definitely something to think about if you predispose to that, or you have family members with that. That would be something to bring up with your surgeon if you're thinking about an elective procedure.
Yeah. Going into summertime, I know when my first surgery, top surgery, was in, I think, late May, early June. And I live near the beach and grew up near the beach. During my first top surgery, I actually had tan lines in general.
Yeah, I remember.
from a bathing suit. So that was pretty interesting the way that looked. But so, and also because of that, I knew, like, going into summer, I was so excited to now, kind of feel great in my skin and want to be outside and with my shirt off. Can we speak a little bit to like how the sun really affects scars and how important it is, especially this summer, to really kind of keep those scars out?
That new skin that's forming over that skin bridge of any scar on your body, it's baby skin. It's fresh, brand new, very new skin, and it can be very damaged by the X-ray, the rays of the sun, basically the radiation from the sun. And you want to be super careful, especially that first summer after any surgery. And what does that mean? For most patients, I say, buy a rash guard with SPF in it. They do make some tapes that have SPF in it, but really you got to, and I have patients who come in with tan lines just around the scar. You have to be super careful. And in general, you want to be careful about sun exposure and skin cancer risks. But specifically for a scar, what we're trying to avoid is the body's natural response to sun exposure, which is the melanin gets activated and you get darkening. That's what a tan is all over your body. But if you get it within a fresh scar, the new skin of a scar, that can become permanent and it can tattoo the scar. And all of a sudden, the chances of your scar actually kind of fading will diminish if you get that kind of sunburn or suntan too early in this fresh skin. So just being super careful with it. You would never put a baby out in direct sun without any suntan or lotion or an umbrella. Don't treat your scars like your baby. Take very good care of it. Be very careful with it that first summer after any surgery. Even if your surgery was in the winter, it still takes about a full year. So you want to be super careful with that. Rai had a question here. What are your recommendations for massaging scars? Great question. So we know that tension across a scar can cause problems in terms, not only acute problems early on where the scar or the incision can open up, and that's called a dehiscence, and that's a major problem that may even require more surgery. But once we get past that acute phase where you have tension on something, that's where we get the spread and a wider scar, and sometimes a thicker scar. So we want to try to avoid that, and we avoid that with, how we do it technically when we're closing wounds, the things that we do to try to reduce tension across that, things we do externally, if we use different tapes or glues, and so in adding compression to it. And then finally, once the scar is knitted a little bit more, we really want to try to get the scar to soften, and that's where massage comes in. And I don't mean going to masseuse, and getting a full body massage. I'm talking, it's really simple. You get 2 fingers and you just kind of do little circle motions all along the scar, wherever it is. And that really helps soften some of the tissue underneath the skin. Whenever we cut into the body, especially for top surgery, but all sorts of surgeries, we're cutting through different layers. We're cutting through the epidermis, the outer layer that you see, the dermis, which is the layer right underneath that, and then the subcutaneous tissue, which is usually the fat directly below that before we get to the muscle. Within that realm of skin, there's something called lymphatics, which are little tiny channels that go through the skin and drain fluid from outside of the cells back towards the central system, collection system, so that you don't get too swollen. If you ever had a night out and you drank too much, or you had a big salty meal and you notice like, hey, my hands are a little bit swollen or my feet are a little swollen, that's because you had more fluid in that area of your body than your body could resorb. And it takes a little while. Sometimes you have to wrap it up or you have to put your feet up, right? And so the idea here is that when we cut into that, we're transecting, we're cutting right through those lymphatics. They don't exist anymore. They have to find a new way to live and drain that area of the body. So massage actually helps kind of manually push the fluid that's building up in that region out and helps soften it. And it also helps retrain the brain that it's okay to touch your scars. A lot of people get scared to say, oh, don't touch it, leave it alone. It's, and you don't want to do that. You want to retrain your brain that it's okay to touch that part of your body, that it's part of you. And maybe you can't feel it as well as you used to be able to, but it will come back with time. So it's super important. Usually I start that around 3 to 4 weeks after surgery and tell them to do it every night, usually with a little bit of lotion or something like that, just along the scars itself. There's something bigger out there called lymphatic massage that really tries to push that fluid back to that central collection system. It's not really that required for smaller surgeries. There are other types of problems that people have that could require those things, but really it's just massage, and it's all about consistency, about doing this every day, for that early post-op period for those first 3 to 4 months after surgery.
Gua sha stones help too, actually. So these use some moisturizer, and it can help with if your hands get tired from massaging. I mean, the top incision and surgeries are pretty long, lengthy scars. So gua sha stones help with the massage process. I think we have some pretty actually good questions. One about sleep. I remember I couldn't sleep on anything but my back for a very long time, which was not exactly really fun. But I mean, same this person's questions. Sleeping in any other position or even slight movement in sleep would cause some irritation or itchiness around the scar area.
Yeah, and that's partly because it's been 4 months since the surgery, and so it's been a long time. I highly recommend, when I have seen my patients, when they are 3 or 4 weeks post-op, I teach them to start raising their arm above their head. We do this little experiment where I get 2 fingers and I walk on the wall and just walk up the wall. And they do that till it feels a little tight in their shoulder, and they go a little bit more. There's this mythology out there, especially amongst people getting top surgery, that if you move your arms anything more than a T-Rex, you're going to stretch your scars. And that is just not true. It's not proven in any science. It's something that somebody put out there to scare patients from doing anything. And that's not applicable. It's just not going to happen. If you were to hang from a jungle gym for 10 hours a day, you might get some stretched scars. But just gingerly moving your arm over your head is not going to do it. So that's where we're retraining the brain. We're teaching it that it's okay to move, where we don't want to get a stiff shoulder, and we want these scars to be part of us. We want to teach your brain that it's okay to use your this part of your body, that your skin is partly there. For that person that's having some issues when they wake up, I would say look into something that has a longer acting type of hydration to the skin, a thicker type of lotion, or aquaphor, cocoa butter, shea butter, something along that's going to be kind of thick and sit on there. Even the stuff that people use on their hands, or something with silicone in it, something that's really going to stick around for a while to hydrate the skin. And then do it again. You have to be careful about, are you taking a shower at night right before you go to bed? What are you using? Is it drying out your skin? Just kind of being cognizant of what your skin needs, because it's an organ and it needs things too.
Yeah, I think keeping that area moisturized before bed and when you wake up will help minimize a lot of that itchiness and irritation that you're experiencing when you wake up in the morning.
Okay, so there's another one here about I had top surgery in September last year, and since it's summer and I'm healing, what can I do to protect my scars during summer? So good question. You're not fully a year out yet, so I would be careful this summer. And the same things I was talking about earlier. Get a rash guard, that the surfers wear that has SPF in it. You can put sunscreen on directly on the scars and then put the rash guard on. I'm sure you're excited to go, without a shirt to the beach, etc. But really double up. You can get the thick stuff, the mineral stuff, the stuff when you put it on your nose and it's blue. You can put that right on your scars. You want a physical barrier from the sun's rays hitting that scar at this time point, because it's too early for the direct sun on that scar right now. Otherwise, you could result in a tattoo. So direct barriers are things like, basically an umbrella that totally cuts out the sun, mineral-based sunscreens, and or SPF, and a rash guard.
I think this can doing physical things too quickly after surgery cause scars to stretch or widen. It's a good question.
Yeah. And the answer is yes. So I have restrictions in place for my patients for the first 4 to 6 weeks after surgery. And some of that is just so they don't end up with, bleeding after surgery or getting a seroma, which is a fluid collection under the skin where the operative site. But also we're trying not to stress freshly bridged skin, right? Like I said, this is baby skin. It's barely mended. It may be watertight at 48 hours, but it really takes several weeks to months for it to be strong enough, across it, tensile strength to resist any weakness and basically dehiscence or coming apart. And so you want to be super careful in those first few months, taking care of it, but follow your doctor's orders. Whoever, did this procedure for you, you should find out exactly what, everyone does this slightly differently. They might have specific recommendations, how they want you to do it. I personally, if you go to me, I say, okay, no heavy lifting, nothing more than 5 pounds for a month. And then from weeks 4 to 6, you can lift up to 20 pounds, go for a light jog, as long as you're wearing some kind of compression shirt. And then after 6 weeks, there's no restrictions. You can do whatever you want. But gradually, I never tell a patient to go, try to get their personal best on their triathlon training on exactly 6 weeks post-op. You have to take time to build up your stamina and strength again. So it's just some common sense. Listen to your doctor. If there's any questions about what you can and can't do, you reach out. Most of us, with some exceptions, are pretty approachable and want best for our patients. And if you have a question, you should just ask the person that's taking care of you.
Yeah, I think just being patient and listening to yourself after your surgery and, just even after the 6 week, just because you're cleared to do something, like Dr. Keith said, you got to listen to yourself. If you're straining to lift something or struggling, then, you're personally not ready yet. I think that one important thing to understand is, like Dr. Keith said, even doctors have different recommendations, but you as an individual, like your healing journey and what your body's going to experience is could be very different from one to another person. It's not going to be the same experience. So you have to just listen to yourself and know what's good for your body when it comes to your healing process. I mean, like I said, it took me more than a year to be able to sleep on anything besides my back. I couldn't sleep on my side for almost a year and a half, and some people have no problems with that way earlier. So it's just no listen to yourself. Don't push yourself if you shouldn't.
Let's see, there's another question here about scar pimples and basically getting these irritations along the scar. So that's an important question. I don't think it's necessarily anything you did to the scar. Some people have folliculitis. Basically, if they have hair growth and you're very hairy along the scar, you can get these irritations. Sometimes you can really truly get little scar pimples. And sometimes that is not what you think it is. It's actually a spitting suture, the type of material we use to sew it up. It gets a little micro infection around it and it wants to find a way out, come out, and it pusses out. It basically becomes like a little pimple and it has to be expressed. If that's an ongoing problem, if it doesn't just heal on its own after a consultation with your doctor, you should go talk to your doctor, maybe see a dermatologist. Sometimes folliculitis is because of bacteria that you're harboring on the skin that need to be treated with antibiotics or different types of soaps, antimicrobial soaps. There's different, reasons why that may happen if it's a chronic condition. So, early on, little things may be surgery related, long-term stuff, maybe something you want to see a dermatologist for.
Yeah, be careful with, lotions, their ingredients vary, but make sure that when using for like massage and stuff or on your face or chest area, that it's a lot of the ingredients are non-pore clogging because some of them can clog your pores and cause pimples and acne.
Yeah, follow up to that is what type of lotions and soaps can I use after surgery that are not alcoholic? So great question. Always follow the advice of your surgeon because everybody has a different protocol and parameter. And so reach out to the surgeon specifically. What we recommend here when I clear it and say it's okay to start using lotion is something that's unscented, kind of neutral and not too aggressive. So things like Eucerin, Lubriderm, unscented stuff, that's usually pretty easy on the skin. And you can always test it, put a little patch of it somewhere far away from your surgical site, make sure your body doesn't react to it and just see if it's okay. What else do we have here? What level of pressure would you recommend for scar massage? I'm 7 weeks and still a bit tender. Totally normal at this time point. Again, defer to your operative surgeon because I don't want to mess up their result. But usually I just say 2 fingers and just push a little bit just so you can feel it and try to massage and you're trying to move some of that fluid out of there. You're not trying to dig a hole all the way to your muscle. You're just gentle, okay? Gentle. All right. Good question so far. So I tried swimming diving the day after I got the all clear to lift my arms above my head again. 4 weeks, mistake. Yeah, I could see that. That could be really. So this is what I talk about. I mean, just because the doctor says go for it, you might want to be a little bit careful. Like Jay says, listen to your body. I say to people, okay, you can sleep on your side or your stomach after a month. You heard Jay's took him a year to be comfortable with that. So again, listening to your body and don't do anything that you think could be really stressful on it. What's the next question here?
We got a bunch.
Here's another one. I had top surgery 4 years ago. Is there anything I can do now to lighten or flatten my scars 4 years post-op? Good question. So it depends on what's going on with your scar. If you have a really thick scar, it could be a hypertrophic or keloid scar, and there could be treatments for that, including steroid injection or even revision surgery. Sometimes there's a role for laser or microneedling as well, and you want to go see either a dermatologist or a plastic surgeon who has an aesthetic component to their practice who offers those things. Without seeing exactly what the issue is, I can't exactly say, well, go do X, Y, Z, but there are things that can be done even if it's much later on. Do you have a recommendation for how often and when to massage scars and how often and when to use silicone-based products on scars? So great. So I usually tell patients to start massaging usually about a month after surgery and do it consistently for 3 to 4 months thereon. And that's usually the time point when I start saying, okay, it's okay to use the silicone-based products now. And I want you to use that for 3 to 4 months after surgery. Another question here. I'm getting top surgery in July and I'm interested in using scar tape, silicone lotion, and scar oil. In your opinion, what is the ideal routine? Tape in the morning and all day, and then massage and lotion at night. I'm okay with splurging on care. Well, good for you. I think that's important to realize that this is an important part of this. There is no perfect routine. And my tweens now are super into skincare, and they're all on YouTube and TikTok, and they're going to Sephora on the weekends, and it's so loud in there. I was just telling Jadis, it's just like, it's like a rave, and everybody's watching the YouTuber influencers and like getting all the steps involved. Listen to your body. It's common sense stuff. Talk to your doctor about what they would like you to do. When I see a patient, it makes sense to me to use something hydrating at night that's going to help reduce, any itchiness that you're feeling and be comforting and soothing to the skin. So, usually some sort of lotion based or something with silicone in it at that time point makes a lot of sense. Silicone is naturally not sticky, right? So if you put something with silicone and then you try to put something sticky with it, like a scar tape, it falls off. This was Jadis's experience. He can tell you more about that. So having, using tape products, it's usually when you're more active. What is tape doing? Other than being a vector to put the silicone there, it's really about giving some compression to the scar and to the tissues underneath to get that fluid out. That's what massage does, but tape can do it well too. So if you're out and moving about and you're active during the day, that's where tape can really come into play and be effective for you. And then at night, give your skin a chance to breathe. You don't have to wear things. I mean, people who bind 24, they come in and they have horrific irritations of their skin. It's the same people with really heavy breast tissue. They have these rashes under the fold of the breast, even if they don't bind, just because it's skin-on-skin contact. And it's where you can get yeast infections and other problems with skin. So you need your skin to give it a chance to get some air. There's an old adage in dermatology. If something, if your skin condition is wet all the time, you want to dry it. And if it's really dry skin, you want to wet it. And what does that mean? It means, listen, if you're in an area that's prone to being hot, humid, and moist all the time, you got to find a way to get that to dry out. And similarly, if it's like your armpit or somewhere where it's always constantly humid and moist, that's where you can get, these fungal infections. You want to dry that out. Or if you're having a really dry eczematous kind of rash, well, that needs lotion, and you have different lotions that you want to use for that. So that's kind of the old adage on how to treat skin, dermatology 101. Let's see. But another thing here, just to say you're okay with splurging on care, things don't have to be expensive to be effective. Some of the most expensive things out there are nothing more than onion extract. And not to, be talking ill about competitors or anything like that. Again, I didn't work on this project with Jadis because I love business. I like being a surgeon, but I really love helping Jadis because I love Jadis and I think he's an amazing human. But really, you have to be careful. Some things out there are just really expensive because they can be, not because they do anything good for you. So it's about following the science and listening to your body and doing what feels good and what your doctor says is a good thing to try. If your incision does open at all, is there a way to prevent the scarring from getting worse while it's closing up? Again, like those wound closure butterfly bandages. Great question. So that's a tough one. If it starts to open up, like the wound actually opens up and you're seeing kind of, the fat underneath, if you put a butterfly bandage across it, it's probably not going to be effective. As soon as bacteria get in there, it's colonized. It's going to have a harder time kind of mending. It will mend eventually, but it's going to take a while. And so follow the instructions of your doctor. Usually there's some local wound care type of things that we're going to ask you to do. And that might be someone who's a candidate for us doing a small revision once it's fully healed, 6 to 12 months later, where we try to go and cut that part out and get it to close nicely. So that's unfortunate when that happens. And you have to be really careful to prevent it from getting worse. So the patients in my practice that have had the biggest problems with that are smokers. So you got to totally avoid any nicotine exposure, smoking, vaping. That stuff's really bad for skin. Why is it so bad? It's not because smoking will kill you. Sure, it will. But I used to be a smoker. I mean, you got to get it. It's not great for your health, but I understand why people do it. It's because nicotine itself will constrict blood supply. And it does that. Just the molecule itself will constrict the blood supply. It causes a vasoconstriction of the blood supply. And when that happens, the blood physically can't get to healing skin. If it can't physically get there, then you get necrosis, which means death of the skin. And that's when your things open up. You get this large scabby healing, things fall apart. It's terrible. So avoiding smoking will really help. Limiting, your physical activity, talking to your doctor about what you can and can't do, following the local wound care recommendations, what they want you to do. Those will really help you. And then finally, and we didn't touch base on this, and it's really important in the last few minutes that we have, nutrition. If you are not eating, and I've had patients who are alcoholics and people who had eating disorders and all sorts of stuff. If you're not eating, if you're not increasing your protein intake during that critical time period, your surgery will fall apart. It will fail. Why is that? Because your body needs the molecular building blocks, the amino acids, to put the cells back together again to heal. And if it doesn't have that, it's going to cannibalize you. And it's going to do that from the areas that are already inflamed, which is your scars and your incisions. So you have to increase your protein intake. You have to be as healthy as possible to try to heal after a big surgery like that. What else do we have? Okay, how does age factor into healing? I'm in my 40s and feel like my recovery is slower than people in their 20s. Great point. And that's what I tell someone who's in their 40s when they come to see me or older. Hey, you're not 18 years old anymore, which is good and bad. Most of my patients who have a thicker scar or a raised scar often tend to be younger. My patients, I used to do surgery under 18. I don't anymore. But those patients in 16, 17, they would often get really thick scars. They're on hormone therapy. They're young and healthy, and they're just this over-exuberant healer. And that's really challenging. So 40s, sometimes they heal just fine, but it can take longer. Just because you read online on Reddit or Transbucket or somewhere that this person, had surgery and they're feeling great after 2 weeks and you don't feel like that, this is your journey, not theirs. And that's okay. It's going to take someone older a little bit longer to get through it. Doesn't make it impossible. It's just listen to your body, know yourself. Sometimes I wake up and my knee hurts and it's because it's Tuesday and it's, rainy outside and it just sucks. And it's like, it just is what it is. As someone in their 40s.
Last question.
Did you have any comments on age?
Me?
Yeah.
Oh man, 34. I mean, today I woke up, it's like you said, it's rainy. I think my shoulder hurts, my hips hurt. But I mean, yeah, we've both mentioned, I think that everyone heals differently. I mean, this situation is like so particular to who you are and what you do on a daily basis and how you take care of yourself health wise. All those things play an important role into how you feel after your procedure. I was in my mid-20s when I got my first top surgery, and I had a shoulder surgery in my my mid-30s, and I mean, even that healing process is different. I feel like I'm still recovering from my shoulder surgery.
Yeah, joint surgery is tough. Yeah. And I'll say this, I have a 70-year-old phalloclasty patient, and he does amazing things, and he heals really, really well. And so sometimes it's just genetic and real lucky. And as somebody, I have 18-year-olds who healed really shocked me because they healed so poorly because they're so terrified to gain weight and be, quote, fat after surgery. And it's just like, you have to eat. I saw the last question on there, Rye, was just about what do you mean about compression? So there are actual shirts that you can buy from a sporting goods store, like the football players wear to warm up in. They give you a little bit of compression, but without being too tight. That's what I mean. Not necessarily a binder, like a surgical binder you'd get after surgery. Just something that's more like a t-shirt, but snug. That's usually what I put patients in after they come out of the binder and while they're still in the healing phase for exercise.
Similar to that rash guard fit and material.
Right. Exactly.
Perfect. Well, thank you so much, both Jadis and Dr. Keith, for your amazing knowledge and expertise. We are coming up on time. It is almost at the hour. I just want to give a little bit of space for you, Jadis, to talk a bit about just like the products that you have at Motivo and the things that do support just people's scar care recovery journeys. If you want to talk a little bit about that as we're wrapping up on things.
Yeah, we can go into that really quickly. We are currently the only ones on the market to offer multiple skin tones and scar tape. And similar to what Dr. Keith spoke about before, is sometimes silicone, specifically when exposed to moisture, isn't really sticky. So we wanted to avoid that in our scar tape for the convenience aspect. And some people also being allergic to silicone in general would still be safe using our scar tape, which the scar tape in general, because of the way it sticks, it helps keep the compression on that scar area. Helps also keep the tension off the skin and the scar to help minimize the stretching in that area. And then our topicals, they're not only just good for your scar in that moment, but they're also good for your long-term skin health. I mean, they have antimicrobials, anti-inflammatory ingredients, help with the pigmentation of the scar and the skin. Both of our topicals are award-winning and are silicone-based, so they're completely moisturizing. We don't have any alcohols in our products, no onion extract. We have actual ingredients that are beneficial for your scar and your long-term skin health. And our roller serum specifically is non-pore clogging, like I spoke to earlier. So it's safe to use on your face and on your chest in areas that are prone to acne. Our cream is, for the most part, it's about 95% non-pore clogging. The only pore clogging ingredient contained in our scar cream is the shea butter, but overall completely moisturizing for the skin and can help at multiple different levels of the healing process. And we provided Plume with a 15% off discount for anyone who would like to try our products. I mean, we hope that you use a brand that you are comfortable with in general and make sure that the ingredients are something that'll work well for you and your skin. And I mean, at the end of the day, whether it's our brand or not, we are happy to, answer questions down the line or just wish you the best in your healing process overall.
Beautiful. And Dr. Keith, would you like to talk a bit about your practice too as a surgeon, and where do you do your practices at?
Oh, yeah, sure. Thank you. So I'm in New York and New Jersey. Our practice is called East Coast Advanced Plastic Surgery. I'm also the president-elect of the Society of Gender Surgeons. And so this is all I do, is gender-affirming care. And I've been doing it for a long time now. I trained in Belgium with Dr. Monstre, and now I'm here in one of our, honestly, just there's a few of us that do this anymore. But it's my passion, and it's been my career, and I'm very happy and proud to be able to serve my patients in this capacity. So thank you so much, everybody.
Yes, thank you.
Thank you. Thanks for having us.
Yes, of course. Last question. If anybody does have, because we had some questions that were unanswered and we're coming up on time. If people do have questions and they want to find answers somewhere, is there a way that they could reach out possibly? Would y'all have a place where folks can find answers to some of the questions they may have?
I'm going to type in my email address, and you can email me.
Thank you so much. Really appreciate that. And
Okay.
I'll make sure to send that as a resource to folks too, in case you
Hey, everybody.
Yeah, scarring, medical questions, Dr. Keith, and then any product-based questions, you could email info@motivoscarcare.com and would be more than happy to answer those questions.